I remind myself and I remind others, everybody has a beneficiary in their family. Everybody is a consumer of health care and services, and how we do our work matters so much, not just in terms of our agency's success, but also for the health and safety of the American people. And there is no higher charge and no higher calling than that. Good afternoon, everyone. Can we ask you to please take your seats so we can get things started here? Great. I'm so glad to see everyone here today. I'm Karen Jackson, Deputy Chief Operating Officer here at CMS, and I hope that everyone has enjoyed the Wonderful CMS staff photo montage, notwithstanding the thing before the last. I didn't know about that. It's a perfect framing for today's celebration of all of your service to the American people. So thank you. I am joined here on stage by a number of people who we're really glad to have here. Thank you for coming. Seema Verma, our administrator. Kim Brandt, our Principal Deputy Administrator for Operations. Demetrios Kouzoukas, our Principal Deputy Administrator and Director of the Center for Medicare. Emily Felder, our Director of the Office of Legislation. Brian Neal, Deputy Administrator and Deputy Administrator and Director of the Center for Medicaid and CHIP Services. And Randy Pate, the Director of our Center for Consumer Information and Insurance Oversight and Deputy Administrator. Welcome to the 2017 CMS Honor Awards ceremony. In addition to the wonderful crowd we have here in the room, I know that there are a lot of people who are joining here on VTC and via WebEx and in conference rooms across this building and complex, as well as our other Baltimore locations, Washington, D.C. offices, our 10 regional offices, and our field offices. And we're really, really, really glad to have all of you here with us today to celebrate the incredible achievements that this team has accomplished over the past year. To begin the ceremony, I am very pleased to introduce Derek Claggett, who will be singing our national anthem. Please join us by standing for the national anthem.
Oh, say, can you see by the dawn's early light what so proudly we've hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming. Then the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Thank you so much, Derek. Please take your seats. Derek is in our Medicare Enrollment and Appeals Group in the Center for Medicare, and we really, really appreciate him sharing his talents with us today. So it's been 197 days since our administrator, Seema Verma, was sworn into federal service by Vice President Mike Pence on March 14th. I counted. And joined us here at CMS. We have had the honor and the privilege of working with her to ensure that Americans who benefit from the programs that we administer here at CMS are served with excellence. There's a saying at CMS that given the importance of our programs and the pace at which they change, a year at CMS is like 7 years at any other agency in HHS or across the federal government. And I'm pretty sure that that time frame doubles for our policy officials by virtue of their role in leading change and how hard I know that they work every day and night. So I'd like to be the first to congratulate Seema Verma for completing just over 7 years of service here at CMS in just 197 solar days. Again, I counted. While we don't have an award for that accomplishment, we do have a lot of others to celebrate today. And so to begin our program, I'm really, really honored to welcome Seema Verma to the podium.
Thank you, Karen, for that kind introduction. Yeah, it's sort of like dog years, I guess is what they say. I'm now getting to a point where I need readers after having my daily briefing book. So, but anyway, I just wanted to say that I'm so glad to be here today and to honor our over 900 members of the CMS family for their outstanding work on behalf of the American people. I'm so glad that right before today's ceremony, I got an opportunity to meet many of you and take pictures for those that are being recognized today. Unfortunately, I'm going to have to leave and head back to DC for a meeting with Dr. Price. So you'll see me head out a little bit earlier, but just so happy to be here today. And I wanted to start out by saying that I'm delighted and privileged to be with you today, not only for the CMS Honor Awards ceremony, but just to be able to serve alongside with all of you at CMS. We serve millions of Americans, and people rely on our programs. We not only provide care, but we try to enhance the entire healthcare system and improve the lives of those that we serve. And as I think about my time here and those of you that I've met, I must say that I have been so thoroughly impressed with the level of professionalism and commitment that each of you bring to your jobs. Even through leadership changes, you continue to serve in an unbiased, neutral way, putting the interest of beneficiaries and providers and those that we serve above all else, doing your job and making a real difference. Today we are here to honor the accomplishments of some of our most outstanding employees. These team members have embodied the true spirit of public service. They have gone above and beyond to accomplish goals and serve our beneficiaries, America's most vulnerable populations. They have done their best, exceeding expectations, and today we are here to honor them. And I wanted to take a moment to, as I was thinking about these awards, I was thinking about an experience that I had a few years back when I was working at a public hospital. And our CEO of the public hospital took us to the Disney Institute. And it wasn't just all Mickey Mouse, although there was a little bit of that. But we were in the Disney Institute around customer service. And they showed us a video, and they have a saying at Disney, and it's called Bump the Lamp. And none of us knew what that was. And they told us the story of how they produced the cartoon or the movie Roger Rabbit. And I know I'm really dating myself by mentioning this, but most people probably haven't even seen that. But there's a scene in the cartoon where Roger Rabbit is in an argument, and he hits a lamp that's hanging from the ceiling. And in the cartoon, you see the lamp, because he's hit it, you see the lamp move back and forth. And what most people don't notice about that cartoon is that in the background, while you see the lamp moving, you also see the shadow from the lamp correspondingly moving back and forth. And it's a very, very small detail that most people didn't see or wouldn't even think about. But the notion there was that those people who produced the cartoon were bumping the lamp. They were showing the movement. And the idea is that they were exceeding expectations. It wasn't required. It wasn't needed. But they were doing their best. They were going above and beyond. And so I thought about that story today as I was thinking about the hard work and the accomplishments of the staff today. All that they have done to strive for success, their commitment to excellence is something that I think about, and I hope that I am able to impart to my own children, and I hope that they aspire to achieve this type of success when they get older. So the team here is truly an example to all of us. Congratulations for all that you have done to help your fellow Americans live longer lives and better lives. Your accomplishments have certainly been lighting our country, and they've been extraordinary. You've developed a needs assessment for Puerto Rico and the Virgin Islands to address the Zika virus. You expanded a model that resulted in national access to evidence-based services to prevent diabetes. You established the Quality Payment Program service and a new customer service management tool, which enjoys almost a 95% customer satisfaction. You've protected individuals in nursing homes from abuse in the single largest healthcare fraud case to date. You implemented different payment models to revolutionize the delivery of healthcare. You significantly increased the effectiveness of business operation functions that support Medicare Part C and Part D, ensuring better programs for our beneficiaries. And you did so much more, which we'll be honoring today in a moment, to improve our performance, increase our efficiency, strengthen our programs, and innovate the ways that we do business. Today, we salute this work and we honor you. Your accomplishments also highlight something else. By thinking outside the box, or improving existing programs, or simply finding better ways of working, you're helping CMS fulfill our overall mission, which is to put our beneficiaries first. You're helping ensure that we make healthcare accessible and affordable for all Americans, and you're helping us meet our strategic goals of empowering doctors and patients, ushering in a new era of flexibility, supporting innovative approaches to improving quality, accessibility, affordability, and improving the CMS customer experience. For all of that, I am grateful, and the American people are grateful. But as we rightfully recognize and honor you today, this ceremony also recognizes the caring and commitment, the dedication and determination, and above all, the public spirit of every member of the entire CMS family. Perhaps nowhere is this more evident than in the incredible assistance that CMS employees are providing today to those affected by the hurricanes, Harvey, Irma, and Maria, back to back. We've seen extraordinary efforts by so many of our colleagues in Texas, Florida, Puerto Rico, the Virgin Islands, and elsewhere, to connect our beneficiaries with services, making it easier for providers to deliver care under very difficult circumstances. What our team has done over the past month what they've done and what they will do is absolutely life-saving. And we're not certainly surprised by the great number of CMS volunteers that have responded to FEMA's call to deploy on the ground in whatever capacity is needed. The American people certainly value all that you do each and every day. They value the sacrifices you make and will continue to make. And they value the incredible contributions and difference you have ensured. Overall, in so many ways, each and every day, you've all contributed to one overarching goal: to put the needs of the people you serve first, always. That, of course, is what all of us at CMS hope for, strive for, and work for. I know that all of you will continue to perform with compassion and creativity, with honor and hard work, and with a desire to ensure that the common good is always the highest good. Without a doubt, I look forward to honoring many future accomplishments. To all of those receiving awards today, congratulations again. Enjoy the afternoon, and thank you.
Thank you so much, Seema, for those wonderful words. So, today we're recognizing more than 900 CMS employees for their outstanding efforts in support of our programs. Over 80 teams and individuals are being recognized today, a testimony to the excellent work being accomplished throughout our organization in service to the American people. Many of you wrote very eloquently about your colleagues' accomplishments, and those nominations were endorsed by center and office directors across CMS. The panel of senior managers across the agency who reviewed and approved all of the nominations had a tough but a really wonderful job. Your accomplishments are so significant. During today's ceremony, each individual awardee and a representative from each team will be introduced on stage. The rest of the team award recipients and the CMS components whom they represent are in your program booklets, and awards will be sent later on for distribution. We've asked several of our career executives who are sitting here in front with us to come up and help honor the awards, and I'm delighted that we also have members of our policy team who will be congratulating you as you receive your awards. So now please sit back and enjoy the next hour as we celebrate our accomplishments over the past year. I'm going to ask Seema to join me here at the podium, or in center stage, always in center. Our first award recipients are being honored with the Administrator's Achievement Award. This, as you know, is the highest honor that we dispense to our colleagues and team members. And it recognizes individual employee accomplishments and teams for outstanding performance and exceptional achievements that contribute to CMS's mission. The awardees for the Administrator's Achievement Award are Adrienne Abrams. Come on up, Adrienne. Adrienne is being recognized for expertly leading the planning, development, and public launch of the Quality Payment Program portal, affectionately known as Q3PO. And if you haven't seen it, you've got to go online and look at it. Rebecca Paul from the Center for Medicare for her outstanding leadership in directing the research, development, and implementation of risk adjustment models that support comprehensive care for over 17 million beneficiaries. The Plan Compare 2.0 team for the successful development and launch of the Marketplace Plan Compare 2.0 system, which is used by millions of consumers to enroll in health coverage. Representing the team is Bob Amos from the Office of Communications. The High Glass Hosting, Operations, and Maintenance Technical Evaluation Panel for their steadfast execution of the TEP, which resulted in a successful award and significant cost savings to the government. Representing the team is Mary Carol Stifler from the Office of Financial Management. And the Alternate Enrollment Team for implementation of complex alternative enrollment to ensure consumers had coverage in a new plan when insurers exited the marketplace. Representing the team is Kevin Jackson from the Center for Consumer Information and Insurance Oversight. The Fraud and Abuse Waiver Team for their outstanding efforts contributing to the success of new payment and service delivery models, and representing the team is Catherine Bernstein from the Center for Medicare. And finally, the 2017 Marketplace Stabilization NPRM team for their outstanding performance and achievements that contributed to the CMS mission of strengthening and modernizing the nation's healthcare system. And representing the team is Lindsay Murtaugh from the Center for Consumer Information and Insurance Oversight. Congratulations to all of the Administrators' Achievement Awards. Our next award in today's program is the Executive of the Year Award. The Executive of the Year recognizes a group-level senior executive service member who demonstrated exemplary achievement and performance that significantly contributed to achieving agency mission, and who was recognized by peers as best personifying executive core qualifications. The awardee for this year is Jeffrey Grant from the Center for Consumer Information and Insurance Oversight. So let me tell you a little bit about Jeff. Over a long career here at CMS, Jeff has been a key leader in the development of new uses of data for effective management of our programs, beginning in the Medicare Advantage program. Billions of dollars have been accurately paid for Jeff's leadership and his innovative approaches to understanding data anomalies within the data environment. Jeff's leadership of marketplace operations, and in particular of the team's response to feedback during the 2016 plan year, can serve as the model for CMS of responsiveness and collaboration with stakeholders. Thank you, Jeff. Okay, moving on to the next award category. Our next award category is the Administrator's Career Impact Award. This award recognizes employees with at least 10 years of service and those employees who have significantly affected the advancement of CMS's mission. Our presenter for this category is Nan Foster Riley, who is Consortium Administrator for the Consortium for Financial Management and Fee-for-Service Operations. So before Nan begins, this is an appropriate time, and this isn't in your script, so sorry. Nan is retiring from federal service at the end of October, and this is her last CMS Awards ceremony. And so what we wanted to do was just take a minute to say thank you and to congratulate her for her service to the federal government and also to our programs. Seema, will you tell me? So Nan,
yes,
we are celebrating. I have things I have to say here,
Okay.
so just let me say them. You need to blush, okay?
I'll do
Ready?
that. I am.
Okay. We're going to celebrate how you have positively touched the lives of so many Medicare beneficiaries and Medicaid recipients throughout your career here at CMS. You've really personified the core leadership criteria of the senior executive service. You are one of the people among us who has willingly moved back and forth between Baltimore and Kansas City, which is your home, where your family and your horses are, to perform many, many special duties for CMS. When we have called, you have come. And you were the first director of the Medicaid Program Integrity Group. You served as the acting director of the Quality Measurement Health Assessment Group, as well as the acting deputy director of the CMCS Family and Children's Health Programs. You'll note Nan has hit practically every single program that CMS administers, and we are so grateful to you for your service. Thank you so much.
Thank you so much. Thank you so much.
All right, back to the business of the day.
Thank you, Karen, and thank you, Seema. I am honored to announce this year's awardees. The awardees for the Administrator's Career Impact Award are Teresa Wilson, Consortium for Financial Management and Fee-for-Service Operations, for 33 years of service to Social Security and Medicare beneficiaries, and to making their health and welfare your #1 priority. Congratulations. Nancy Schmidt, Consortium for Financial Management and Fee-for-Service Operations, for superior performance, sustained excellence, and dedication to CMS's programs and operations. Melanie Marolf-Vetchuk, Office of Hearings and Inquiries for outstanding service to the Provider Reimbursement Review Board, the PRRB, for 28 years by providing expert legal guidance to the board, staff, and PRRB stakeholders. Jeffrey Kelman, MD, Center for Medicare, for superior leadership, clinical expertise, and dedication to the successful implementation and administration of the Medicare prescription drug benefit, program monitoring, and interagency collaborations. Congratulations. Congratulations to all of the Administrator's Career Impact Awardees, and I'll turn the program back to our very sneaky Master of Ceremonies, Karen Jackson. Thank you.
Well, unfortunately, when the boss calls, the boss calls. So I'm going to be heading out here, but I just again want to say it's been such a pleasure to be here and recognize these accomplishments today. And I really wish I could have stayed because I'm also going to miss the cake, but I do need to head out. And again, thank you all for being here today, and congratulations to all of the awardees. So pass it back to Karen. Thank you.
We might save a piece of cake for her, but I don't know. So there are some other awards that are registered in your programs, and one that I am particularly fond of mentioning, although the people who are recipients of the awards, many of them don't want to acknowledge this, so we are doing this for them. There are 9 people in CMS who celebrated their 40th anniversary of service to the federal government and primarily to the Social Security and Medicare programs. And there may be a few who are surreptitiously here in the room. Their names are in the programs, and you'll find them on page 29 of your program. And I just would really like to thank them for their service. So if you'll join me in giving them a round of applause wherever they are. Okay, so our next award category is the Customer Service Award. This award recognizes individuals and teams who provide exceptional customer service beyond the normal course of duty to our beneficiaries and consumers. So these are sort of externally focused awards. We'll talk about internal service a little bit later on. Our presenters for this category are Jonathan Morse, the Acting Deputy Administrator and Director of our Center for Program Integrity. And Jonathan will be joined by Brian Neal, the Director of our Center for Medicaid and CHIP Services and Deputy Administrator, and they will present the awards to the recipients.
Okay. Thank you, Karen. Thank you and good afternoon. So I'm pleased to present the awards for the awardees for the Customer Service Award. And so they are for the Dialysis Facility Compare Team for outstanding efforts rolling out Dialysis Facility Compare, improving consumer comprehension of healthcare quality data, and increasing site sessions by 10.31% and site visitors by 25.8%. Representing the team is Elena Balinkoloff for the Center for Clinical Standards and Quality. Next actually is going to be an individual person. It's Laura DiVirgilio from the Consortium for Financial Management and Fee-for-Service Operations. Laura, for using your policy expertise and practicality to empathetically ensure beneficiaries obtain all Medicare benefits and rights. Your astute trend analysis improves Medicare processes and operations. Thank you. Next up is the CMS Data Matching Resolution Team for improving healthcare.gov's data matching issue processing and ensuring continuity of marketplace coverage and or financial help to more than 1.8 million marketplace consumers in 2016. Representing the team is Anthony Calabrese from Office of Communications. Next is the CMS social media team for continuous improvement in CMS's social media content and interaction with our growing audience of over 1.6 million followers across CMS social media channels. Representing that team is Johnny Vo, also in Office of Communications. Next is the Consumer Accessibility Resource Team for outstanding teamwork and collaboration supporting CMS's ability to provide external communications to over 15,000 beneficiaries and consumers with disabilities in a timely manner. And representing that team is Wilfredo Reyes Maldonado, in the Office of Hearings and Inquiries. Next up is the Data Disclosure System Transition Team for dedication in designing and transitioning the new data disclosure tracking system. Representing that team is Tom Latella from the Office of Enterprise Data Analytics. Halfway through. Next up is the Marketplace Consumer Record Team for building a new marketplace consumer data system in support of critical marketplace goals for customer service, data sharing, and cross-component coordination. And representing that team is David Edwards from the Center for Consumer Information and Insurance Oversight, CCIO. Thank you. Next, we have an individual award for Damaris Rivera for the Consortium of Medicare Health Plan Operations for your unwavering commitment to always consider the needs of the customer and your determination to treat each as you would want to be treated yourself. Thank you. Next up is the Medicare and Medicaid Provider Enrollment Outreach Team. In recognition of the Provider Enrollment Outreach Team's significant contribution to CMS through provider outreach and education that reduces the burden to the provider community and impacts America's access to care. And representing that team is Alicia Banks from the Center for Program Integrity. Next up. The consumer-friendly CPT Code Descriptors Translation Team, that is a mouthful, for providing Spanish translation of over 9,300 consumer-friendly CPT code descriptors for use on the Medicare Summary Notice. Representing that team is Lizette Ledden from the Office of Communications. Next up is the Division of Ethics Management for continuously and tirelessly maintaining superior excellence in customer service and always going the extra mile for your clients. And representing that team is Joyce Lewis from the Office of Human Capital. Next is the Freedom of Information Group for providing excellent customer service and going beyond the normal course of business and duties to communicate to the public, beneficiaries, and consumers by collaborating within and outside of CMS. Representing the team is Desiree Gaynor from the Office of Strategic Operations and Regulatory Affairs, ASORA. And lastly, we have the White House Casework and Correspondence Team, providing direct support for the President and his staff by providing timely, high-quality services to 8,700 customers seeking health insurance. And representing that team is Ron Onion from the Consortium for Medicare Health Plan Operations. Congratulations to all of the Customer Service Award winners, and I'll turn this back to Karen Jackson to continue the program. Thank you.
Thank you so much, Brian and Jonathan. So before we go to the next award category, I want to also make note of another item that is in your program booklet. If you go to page 31, you will note that we have another group of amazing CMS people who are finalists for what we call the Sammie Awards. Last year, you'll remember that one of our teams from the Center for Clinical Standards and Quality was honored for the work that they had done in improving patient safety. This year, we had a group of people from the Center for Medicare who were nominated for the work that they've done on the Medicare Shared Savings Program. The Partnership for Public Service Samuel J. Heyman Service to America Awards are the highest award in federal service. And this year, John Pelot and Heather Grimsley were recognized last night at the Sammie Awards as finalists for the work that they've done on the Medicare Shared Savings Program. I don't know if they're here today, but I hope that you will join me in giving a really big round of applause and thank you to them. And our next award category is the Execution of Major Projects. The Execution of Major Projects Award recognizes individuals and teams whose efforts resulted in the implementation of a major project that would help ensure that millions of Americans have access to high quality and affordable health care. Our presenters for this category are Jean Moody Williams, the Deputy Director of the Center for Clinical Standards and Quality, and one of the recipients of the Sammie Award last year, and Demetrios Kouzoukas, Principal Deputy Administrator and Director of the Center for Medicare. Jean is here. Sorry.
Thanks so much, Karen, and good afternoon. Very, very excited to be able to present this award. As it says, major projects, the execution of major projects. Our first award goes to the New York Regional Office Cross Consortium Territorial Specialist Team for developing an impact analysis of Puerto Rico's financial crisis and developing a needs assessment for Puerto Rico and Virgin Islands to address the Zika virus. Representing the team is Eduardo Reyes, Consortium for Medicare Health Plans Operations. Next, we have the Cases, Hearings, and Appeal Modernization Project, known as CHAMP, for tireless efforts in developing the Office of Hearings Case and Document Management System, and outstanding contributions towards CMS's enterprise Salesforce modernization. Representing the team is Kevin Keck from the Office of Hearings and Inquiries. We have an individual award for Elizabeth Garbachek from the Center for Medicaid and Children's Health Insurance Program Services for tireless dedication and extraordinary leadership in standing up a new CMS Zika Healthcare Services Program. Thank you. The Access to Covered Medicaid Service Regulation Team for outstanding accomplishments in the implementation of the Access to Covered Medicaid Services final regulation. Representing the team is Jeremy Solankas, Center for Medicaid and Children's Health Insurance Program Services. Now, the Medicare Diabetes Prevention Program expansion team's done some great work for the first expansion of a prevention-focused innovation center model, resulting in national access to evidence-based practices for diabetes prevention, services that are delivered in the community. Representing the team is Carly Bird from the Center for Medicare and Medicaid Innovation. Also from the Center for Medicare and Medicaid Innovation, we have the State Innovation Group Division of All Payer Models for implementation of the Vermont ACO and Pennsylvania Rural Health All Payer Models while amending the Maryland All Payer Model to increase Medicare savings and improving these state populations. Representing the team is Nisha Bhatt, again from the Center for Medicare and Medicaid Innovation. Thank you, Nisha. So for cloud computing services, for excellence in delivering and adopting of cloud computer hosting services and capabilities at CMS, we would like to acknowledge Jerry Kuhn from the Office of Information Technology. We have Tracy Lee for the successful design of Medicare fee-for-service final action algorithms, including the reprocessing of 7 years of statistical analytic files from the Office of Information Technology. Thank you. The marketplace verification of special enrollment periods, and this is for tireless effort to launch a new front-end verification process for marketplace special enrollment periods. Representing the team is Kelly O'Brien from the Center for Consumer Information and Insurance Oversight. So the next several teams are for the Quality Payment Program associated with implementing MACRA, and I'm very pleased to acknowledge the Quality Payment Program Integrated Project Team for excelling in cross-component collaboration to achieve outstanding results for clinicians and beneficiaries as CMS implements changes to clinician payment, the first of its kind in 30 years for MACRA. Representing the team is Mindy Riley from the Center for Clinical Standards and Quality. Also from this Quality Payment Program is the engagement team for promoting understanding and maximizing participation through customized communication, education, outreach, and technical assistance support that meet the needs of diverse clinician practices and patients. Representing the team is Adam Richards from the Center for Clinical Standards and Quality. We'd like to recognize the Quality Payment Program Service Center Workstream team for standing up the Quality Payment Program Service Center and a new customer service management tool with total customer satisfaction rate that exceeds industry standards of 94.5%. Representing this team is Brandon Tennyson from Center for Clinical Standards and Quality. Brandon? Beneficiary and providers support to reduce inappropriate billing of qualified Medicare beneficiaries. For promoting beneficiary and provider awareness of the prohibition on billing qualified Medicare beneficiaries while strengthening CMS's support and system capacity to promote compliance. Representing the team is Kim Glon from Federal Coordinated Healthcare Office. Please join me again in congratulating all the recipients of the Execution of Major Projects Award. Thank you. Back to Karen.
Thank you so much, Jean and Demetrios. So this year, the Leadership Development and Recognition Board selected 3 CMS managers who are adept managers and through their accomplishments have demonstrated tremendous leadership skills as well. We say here at CMS that a good manager knows how to execute projects when the need arises, but a great leader can recognize the need for the project long before we need to start the project. So congratulations to Jennifer Shapiro, Louisa Rink, and Heather Lang for their Excellence in Leadership Award recognition from the LDRB. Please join me in giving them a round of applause. So our next award category is the Internal Service Award. This award recognizes individuals and teams that consistently and exceptionally contribute to CMS achieving its mission through actions that improve CMS employee experience and facilitate better organizational performance. Our presenter for this category is Janet Vogel, the Deputy Director for Operations in the Office of Information Technology and the Deputy Chief Information Officer. And I'm happy to invite Kim Brandt up to help to present this award. Janet, Kim?
Well, I'm pleased to present awards to those whose internal service supports the ultimate success of external achievements. And the awardees for the Internal Service Awards are, first is the Provider Data Team, for helping support CMS mission by making the provider enrollment revalidation data easily accessible on data.cms.gov. Representing the team is Vani Anandata, Center for Program Integrity. We also have Office of Communications Press Team for endless dedication to the demanding and stressful work of the press team with a commitment to thoroughness, clarity, and excellence. Representing the team is Tony Salters, Office of Communications. Thank you. Conrad Bovell, Office of Financial Management, for excellence in IT security. Employee Engagement Team, for exemplary work creating and launching new, innovative, and successful ways to engage CMS employees with remarkable results. Representing the team is Lonnie Giroux, Office of Human Capital. Beneficiary Premium Billing and Enrollment Data Exceptions, Central/Regional Collaboration Team, for successful central and regional office collaboration on resolving Medicare entitlement, eligibility, enrollment, and premium billing data issues for CMS that greatly improved agency efficiency. Representing the team is Tawanda Fields, Office of Hearing and Inquiries. Amy Chodakal, Office of Support Services and Operations, for tremendous support efforts automating credentialing processes which resulted in cost savings to the agency and improved customer service. Thank you. CMS Health, Safety, and Wellness Activities Team, for exceptional support to services that promote quality of work life and a safe and healthy work environment for CMS employees. Representing the team is Renee Carr, Office of Support Services and Operations. We've got a fan club. Medicare Secondary Payment Electronic Process, for exceptional innovation and teamwork, implementing the Medicare Secondary Payer Electronic Workflow Process, saving sufficient time, effort, and cost. Representing the team is Patricia Elston, Consortia for Financial Management and Fee-for-Service Operations. And Alan Fredericks, Office of Financial Management, for outstanding customer service to the Financial Management Services Group Program Office. Thank you. CMS Information Technology Strategy, for superior performance in the research, collaboration, development, and publication of the CMS Information Technology Strategy. Representing the team is Fatima Millar, Office of Information Technology. Elizabeth Sellers, Center for Program Integrity, for exceptional contributions to the Open Payments publication, which ultimately improved the organizational performance of the whole team. Thank you. So congratulations to all of the Internal Service Award winners, and I'll turn the program back to Karen. Thank you.
So these next couple of categories are among my favorites, but I like them all. So thank you to Kim and Janet. Another little piece to look at in your program. Each year, the Federal Executive Board recognizes outstanding federal government employees across the government who have performed exceptional and meritorious work. This year, 6 individuals and groups showed the rest of the Baltimore Federal Executive Board just what it takes to make CMS so special. And I would like to recognize Lisa Parker, Aaron Blackshire, Nidhi Singh Shah, Stacey Armstrong, Wade Zarello, and the Impact Act implementation team for their exceptional performance and their recognition by the FEB. Please join me in giving them a round of applause. And you'll find their accomplishments well written on page 35 of your program. So our next award category is for operational excellence. The Operational Excellence Award recognizes individuals and teams for creativity, innovation, or best practices that lead to improvements in process or program administration. This is a long one because there are a huge number of accomplishments and recognition here. And I thank all of you for the commitment that you've demonstrated for operational excellence. Our presenters for this category are Jennifer Main, the Director of the Office of Financial Management and our Chief Financial Officer, and Randy Pate from the Center for Consumer Information and Insurance Oversight.
Thank you, Karen. I'm honored to present these awards for operational excellence. This year's awardees, the first one is the Compliance Activity Module Enhancements team for working collaboratively with colleagues across the group to improve transparency of compliance activities that may result from audit findings and corrective actions. Representing the team is Linda Anders from the Center for Medicare. The next group is the CMHPO National Casework Quality Assurance Review Team. The award is for extraordinary teamwork and contribution to the successful evaluation sampled from 4,500 special enrollment periods requiring CMS review during the CMHPO National Casework Quality Analysis. Representing the team today is Lisa Yang, Consortium for Medicare Health Plans Operations. The next group is the Cmmi Model Overlap Co-Occurring Initiatives Workgroup for improving the ability to define, understand, and evaluate the impact of the role of model overlap in Cmmi initiatives. Representing the team is Susanna Caffardi from the Center for Medicare and Medicaid Innovation. The next team is Protecting Individuals from Human Trafficking, Medicare Fraud, and Abuse for distinguished service in protecting individuals in nursing homes from human trafficking and abuse in the single largest healthcare fraud case. Representing the team today is Phyllis King from the Consortium for Quality Improvement and Survey Insert Operations. Next up, we have Healthcare.gov Digital Marketing and Privacy Team. This group is being awarded for utilizing new, emerging, and innovative ways to reach the important marketplace young and healthy target audience while ensuring that citizens' privacy was protected. Representing the team today is Seth Edlavich from the Office of Communications. Next is the Partner Relations Outreach Team. This group was successfully engaged those in the entertainment industry with large Twitter followings to tweet marketplace messages. Over 40 million followers were reached. Representing the team is Joyce Johnson-Williams from the Office of Communications. Next, we have an individual award for Stanley Hack from the Office of Information Technology. His award is for significant contributions to increase the efficiency and effectiveness of business operations functions for CMS's systems that support Medicare Part C and Part D. And next, we have another individual award for Michelle Edmondson Parrott from the Office of Strategic Operations and Regulatory Affairs. She provided operational excellence via implementation of the executive-level paperless review, approval, and signature process for the administrator's policy, regulatory, and official correspondence documents. Next up, we have an award for the CMS Administrative Technology Solutions, CATS, the Ethics e-file team. They developed and implemented the CMS CATS Ethics e-file system, thereby increasing accurate reporting and decreasing time for completion and review of forms. Representing the team today is Richard Witherspoon from the Office of Support Services and Operations. Next, we have the Ccsq Hiring Improvement Team for implementing efficient and effective best practices to improve hiring outcomes, resulting in a reduced vacancy rate and successful hiring of macro mission critical positions. Representing the team today is Jamie Palmer from the Center for Clinical Standards and Quality. Next, the Medicare Administrative Contractor, the MAC Performance Dashboards Workgroup. They did an outstanding job on the requirements for the development and implementation of the MAC Performance Dashboards, allowing CMS to enhance performance oversight and procurement activities. Jennifer Balzano is representing the team today from the Center for Medicare. We're crossing the halfway threshold here. The next award is for the Medicare Beneficiaries Date of Death Corrections Team for exceptional cross-agency collaboration connecting improper beneficiary dates of death. It's representing the team today is Tammy Johnson from the Office of Information Technology. Next, we have the Exception Review Team for the outstanding efforts of the Exception Review Team for their outstanding methods to improve the way that the Medicare Advantage program assesses provider network adequacy. Representing the team today is Kelly Ordonio from the Center for Medicare. Next up, the CMCHO Knowledge Transfer Team for creating and maintaining a consortium-wide national training plan and resource. Representing the team today is Kathy Leonis from the Consortium for Medicaid and Children's Health Operations. Next, the Regional Medicaid Enterprise Systems Cross-Functional Pilot Team for pioneering a streamlined approach to collaborating with states on Medicaid IT enterprise projects. This model will enable major process and program administration improvements for CMS and states. Today, the team is represented by John Allison, who is from the Consortium for Medicaid and Children's Health Operations. The Enrollment Surge Pilot Team, ESP, for outstanding efforts in substantially increasing the consumer and issuer experience by utilizing cross-component collaboration, contributing to decreasing issuer casework by 30%. Representing the team today is Heather Lang from the Consortium for Medicare and Health Plans Operations. Next, we have an individual award for Heidi Amaru from the Office of the Actuary. She was successful in developing the initial FQHC market basket as required by the Affordable Care Act to update roughly $2 billion in FQHC Medicare PPS payments in calendar year 2017. We have another individual award for Daniel Levinson from the Office of Acquisitions and Grants Management for his unwavering commitment and tireless effort to transform and improve the acquisition of digital services at CMS. Next, we go to the Medicare Current Beneficiary Survey Team for their team's improvements and modernization in the collection of survey data and dissemination of data products. Representing the team is Joanne Francie from the Office of Enterprise Data and Analytics. Next, we have the Consolidated Call Letter Integrated Project Team for the consolidation of the integrated IT and non-IT budget and acquisition forecast call letter. Representing the team today is Daniel Albrecht from the Office of Financial Management. And another OFM award, the Legislative Budget Tracker Team for the creation of a Legislative Budget Tracker and Form. Representing the team is Patrick Wynn from OFM. The Medicare Secondary Payer ORM Recovery Team for working tirelessly to expand Medicare secondary payer recoveries to include non-group health plan ORM occurrences. Representing the team today is Karen Oshab from the Office of Financial Management. And last, but definitely not least, is the Hospital Appeals Settlement Process Improvements for efficiencies in the Medicare appeals system to support the hospital appeals settlement process and reduce the appeals backlog at the Office of Medicare Hearings and Appeals. Representing the team today is David Adams from the Office of Information Technology. Congratulations to all of the Operational Excellence winners, and I will turn the program back to Karen Jackson, our Master of Ceremonies.
Thank you, Randy. Thank you, Jenny. So before we present the next award category, there's one other group of CMS employees that I want to recognize. I don't see very many of them. In fact, I only see one uniform here. But the commissioned corps. In your program, you'll see a number of pages devoted to recognizing members of the commissioned corps who are CMS colleagues. And the last few months, particularly the last 30 days or so, have been particularly challenging for our programs, and our colleagues from the Commission Corps have stepped up and been deployed to many of those places that have been affected by the hurricanes. They're always available to deploy, and they're always available to serve in multiple capacities, including as our colleagues. And I want to thank them for their service and specifically for the work that they've done on the hurricane recovery activities. So please join me on that. So our last award category today, and then it's cake, is valuing stakeholder feedback. This award recognizes teams and individuals who have demonstrated through their work products or projects or actions the perspective of CMS stakeholders, clinicians, beneficiaries, consumers, and many others, through active engagement and integration into the end result. Our presenters for this category are Renard Murray, who has been very active in valuing stakeholders over the last month and leading some of the hurricane recovery activities out of Atlanta. He is the consortium administrator for the Consortium for Quality Improvement and Survey and Certification Operations. And with him will be Emily Felder, the director of our Office of Legislation.
Thank you, Karen. It's a pleasure to be here today and an honor to present the awardees for the Valuing Stakeholder Feedback Award category. First award goes to the Gender Reassignment Surgery National Coverage Determination Team. And that's for engaging with beneficiaries, professional organizations, federal agencies, and other stakeholders. Representing the team is Linda Gusis from the Center for Clinical Standards and Quality. The next award goes to an individual, that's Maureen Kerrigan with the Consortium for Medicare Health Plans Operations, and it's for the Department of Insurance S&P Liaison, for recognitions of the Department of Insurance Liaisons fostering of collaboration with state departments of insurance. Maureen? The next award goes to the CMS 500 Form Medicare Premium Bill Workgroup for the successful implementation of the revised Form CMS 500 Medicare Premium Bill and brochure. Representing the team is Michelle Bain with the Office of Financial Management. The next award goes to the ACA Risk Adjustment Team for working closely with stakeholders to transform the HHS Risk Adjustment Program and stabilize private health insurance markets. Representing the team is Kelly Drury with the Center for Consumer Information and Insurance Oversight. The next award goes to the Marketplace Insurer Engagement for sustained engagement and dialogue with marketplace insurers to respond to their feedback, anticipate changes in the marketplace, and retain and recruit recruiters in the federally facilitated marketplace. Representing the team is Dan Miller with the Center for Consumer Information and Insurance Oversight. And the final award goes to the 2017 Medicare Parts C&D Civil Monetary Penalty, CMP methodology team, for incenting sponsors to provide medically necessary health services and drugs through the release of CMP methodology in response to industry stakeholder comments. Representing this team is Brian Rossi with the Center for Medicare. Thank you, Emily, and congratulations to all of the Valuing Stakeholder Feedback Award winners. And now I'll turn the program back over to our Mistress of Ceremonies, Ms. Karen Jackson.
So we did it. What a year it's been. Thank you so much, Renard and Emily, for presenting the last category of awards this afternoon. And one last time, we're not finished yet. One more last round of applause for everybody for their tremendous accomplishments this year. And I think you know that putting on a celebration like this takes a lot of work and a lot of preparation. And we owe particular thanks to our colleagues in the Office of Human Capital, the Office of Support Services and Operations, and the Office of Communications for putting on a really, really good party. So thank you to all of them, too. So we do have cake out in the reception area. There's also a photo station set up here in Baltimore for those of you who would like to have photographs taken. We also have cake at all of our outlying buildings here in Baltimore and the regional offices, and I think there might be some cake in DC too, so Seema still gets a piece. And on behalf of the CMS administrator, our principal deputy administrators, our deputy administrators, our principals, and our deputy chief operating officer, thank you so much for coming today. Thank you so much for your service to our programs, and enjoy the rest of the afternoon.